To look at some of the deadliest cancers, the therapies are very, very limited. And chemotherapy is not significantly improving outcomes for decades now.
CAR T cells have transformed treatment for people with leukemia. There are certain types of leukemia that just a few years ago were a complete death sentence, that you'd get diagnosed and then within a year you'd be dead. And these were like leukemias that affected young people, sometimes children. And CAR T cells have cured a lot of these patients with deadly diseases. And for a little while there, we got very excited and we thought all the cancers were going to be cured with these CAR T cells. We found it. We found the magic that's going to cure everybody with cancer. And what we realized is it's not that easy. That, yeah, sure, there are some cancers that may respond well with CAR T cells, but for a lot of cancers, especially solid tumor cancers, it's very tricky to get these CAR T cells to work. Some patients, it seems to help them, but for a lot of patients, it doesn't work as well as we think it should. So that's why I'm a medical oncologist. I treat human patients with sarcoma. And I thought, well, I should form a collaboration with Tim and we could try and treat the dogs. These are CAR T cells that are programmed to attack the dog's cancer. These are cells that we take from the dog and then we reprogram them to attack their cancer. And the goal is to eliminate their cancer so that it goes away and doesn't come back. I think we're going to see amazing responses even with our first coming patients. These could absolutely lead to cures for the dogs with sarcoma, because that's what we're trying to do. But I think as we do more and kind of fine tune things, we're going to improve our success rate more and more. And hopefully we can get this to be the kind of therapy that works for most of the dogs that we treat. T cells are the cells that go around your body looking for infections, looking for cancers. They're looking for something foreign. They have a certain protein that's on their top of them that looks for these things. It's called the T cell receptor. And a CAR T cell is a T cell where we've taken that T cell receptor and broken it apart, and so that it's still kind of signaling into the cell the same way, but now is looking for something different. We've programmed, that's how we say we programmed it to look for the cancer. So, and that's what we're doing here. And we're treating the dogs with the T cells, but what we're planning to do is to introduce some other drugs that we think might help the T cells find the cancer and help them enter the tumors and kill the cancers.
What Seth and I are very focused on is to look at some of the deadliest cancers that are affecting dogs. The therapies are very limited. And we know that these type of tumors, mostly sarcomas in these dogs, are very problematic, and chemotherapy is not significantly improving outcomes for decades now. But there has to be a leading edge of discovery to really push the boundaries. And I think that this is a great opportunity for us to bring cutting edge immunologic science to try to treat and improve the quality of life of dogs with deadly sarcomas. That the sarcomas are hemangiosarcoma as well as osteosarcoma. Both of them are highly metastatic. And I think that hemangiosarcoma is very fast moving, that chemotherapy might have some benefit, but there are a lot of pet owners that if they have very limited time with their pets with very aggressive cancers, then they have a lot of second thoughts about, well, do I want to actually put my dog through chemotherapy in which the benefit is very limited? And so I think these pet owners are valuing quality of life. And I think this is where CAR T cells, the opportunity to fit very well into that goal. The CAR T cells that we're giving is a single-time infusion. It is very well tolerated. Again, the science behind it is to have this genetic engineering of the patient's own T lymphocytes, allow them to then get activated and expanded in an experimental lab setting, and then to reintroduce these fighting T cells into that patient again to identify and fight their cancer. We have very high hopes that we're going to be able to push the boundaries and advance therapy for dogs with metastatic sarcomas. We know that for solid tumors, CAR T cells is very challenging. There are three fundamental reasons. One is that often the target that you try to identify may be variably expressed within the tumor cells within a solid tumor. So not all the tumor cells will have high expression of the target. That's very different than often the leukemias or the hematopoietic tumors that CAR T cells are used for right now in people. Another limiting factor that, Seth and I are really excited about trying to discover new ways to try to get around is the immunosuppressive environment of solid tumors, right? So as T cells get into the tumor, whether they be natural CD8 T cells or if they're genetically engineered CAR T cells, the environment of a solid tumor is very immunosuppressive, and that tends to turn those CAR T cells off. And that's where Seth and I have thought strategies that we can couple with the CAR T cells to actually allow them to persist and continue to fight within that tumor microenvironment. And a third variable that we know is a problem with CAR T cells in solid tumors is the physical barrier that solid tumors create, right? So the T cells have to actually get out of the bloodstream. They have to get into a tissue which often is protected by extracellular matrix or the proteins that are put down by those tumors. So those are three barriers that we're all trying to address in our therapies with dogs. And I think that we're going to make great advancements in our understanding about how CAR T cells can be used in veterinary medicine. I think that, CAR T cells will become a very pivotal piece in the toolbox, therapeutic toolbox. It also can help guide future clinical trials that be using the information that we learn from dogs to help people as well. If you have very, very robust T cell attack against the tumor cells, a lot of that attack is through the secretion of these inflammatory proteins called cytokines. And so if you have a really, really robust inflammatory response, you can get something called cytokine release syndrome. And very fortunately, from our experience with CAR T cells in dogs with these metastatic sarcomas, we have not seen any cytokine release syndrome during infusion or shortly thereafter. I think that it's been very, very safe from our perspective in our own experience.
Those complications are usually a side effect of the treatment working. If you have your dog has a deadly cancer and there's really no treatment, cytokine release syndrome is terrible. But if you're having it, the solace that you can take is to know that the cells are working and they're doing something and they're fighting back the cancer, and that you may get, hopefully you'll get through the other end of it and the dog will be better. I think as a general statement, the CAR T cells are far better tolerated than other cancer treatments, certainly better than the typical chemotherapy that the dogs might have. Goal is to get them through one treatment and then be done with cancer treatment.
What we're looking for are dogs that have metastatic sarcomas. Are focused very much on hemangiosarcoma and osteosarcoma. For hemangiosarcoma, most of our patients have splenic hemangiosarcoma that has been surgically removed. So locally controlled disease is something that we would want the patients to undergo splenectomy. And we are really looking to recruit patients that either have some small degree of residual disease that may be identified in their liver at the time of surgical exploratory that cannot be removed at the time of surgery. We're also looking for dogs that do not have any evidence of measurable disease after splenectomy. So either of those two groups of hemangiosarcoma dogs would be enrollable. I do want to echo that hopefully being able to capture some patients and recruit them at an earlier stage disease, this will give us a better opportunity to evaluate the long-term benefit that's derived from the CAR T cells. Hemangiosarcoma certainly we're interested in. Osteosarcoma is another tumor type that we're very interested in. Seth and I are trying to recruit dogs with two different stages of disease. So one group of dogs we're interested in are looking at measurable metastatic disease. And so these are often dogs that have undergone standard of therapy with amputation and chemotherapy, and then they are now presenting with the development of pulmonary metastasis. So we're certainly wanting to recruit those patients for CAR T cell therapy. And because they have measurable disease, we are able to actually track radiologically with like a CT scan their positive benefit of the CAR T cells in holding the disease steady or shrinking down the tumors. That's one patient population we're wanting to recruit more of. And then we have another group, which are dogs that have not been treated with chemotherapy, but we are planning to give them either CAR T cells before amputation or CAR T cells after amputation. And we want to evaluate different types of additional therapies that we can use in conjunction with CAR T cells based upon trying to reverse some barriers that maybe tumors are putting up to protect against immune recognition. They don't need to have amputation. If you have a dog that has been very well treated with radiation therapy and the local disease is well controlled, then we would certainly consider them to be enrolled into the trial. We're very interested in looking at soft tissue sarcoma, and we do have data that suggests that soft tissue sarcomas are very strongly expressing the target B7H3, which CAR T cells are being engineered to recognize. I think, if there are recurrent soft tissue sarcomas, and absolutely we would like to see those patients as well. For our ongoing CAR T cell trials, there's no cost to the pet owner once the pet has been recruited to studies. All of the therapy in relation to the CAR T cell is paid for, as well as all the diagnostics.